We welcome all the WiSH stakeholders to this meeting and seminar, and also welcome our co-hosts for these webinars, SASMA, South African Sports Medicine Association. Also, just to give a plug to the SASMA conference, which is coming up in September, October. If you just go onto the website and have a look and register for that, you're going to find some outstanding sessions presented by international and local speakers. And we're very pleased to host two international caliber speakers this evening in this WiSH webinar, which is really presented in association with our sponsors, Asino Lita Pharmaceuticals, who've been our partners for a couple of years. Those of you that were at the WiSH conference in March will remember Asino Lita as the title sponsor of that conference as well. So they've really been great supporters of WiSH and sport and exercise medicine, and we thank them for their ongoing support. Also, just to thank Dr. Robin Saggers for all the work he puts into these webinars behind the scenes. He's been at it again today, setting everything up, and to our WiSH administrator, Nadine Peterson, for helping with the communication as well. So we welcome you all. We've really got a very good and extensive audience across a spectrum of medical and athletic disciplines this evening. So we've had about 360 registrations, which is fantastic. And I think if we look at the two speakers this evening, it's no wonder, because we really got some outstanding speakers with an excellent topic, which is going to hold us riveted. Those of you who were at the WiSH Congress might have attended the workshop presented by Lauren and Parys, which really was an outstanding introduction into how we should be operating from a multidisciplinary point of view, which is something, of course, that WiSH encourages. And so I'm going to introduce them briefly and then hand over to them for the rest of the session and ask you, if you have any questions, please to post them in the question and answer facility on Zoom at the bottom of your screens, and we'll do our best to put those to the speakers and to have them answer them at the end. So on to our speakers for the evening. Parys Edwards is, like all good medical professionals, a graduate of WITS. She has really an extensive CV, which across physiotherapy has covered things such as trauma and orthopedics, A&E, and she's been in private practice for some time. She's also worked in the United Kingdom, and she's really covered a spectrum of athletes, all the way from the weekend warriors to Olympic athletes. And she spent 5 years as the physiotherapist to the England under-19 women's football team as well. She is no mug herself when it comes to sport, and she's had an outstanding career in her own right, playing hockey in the English Premier League and in South Africa at provincial and national level. She's then competed for 5 years as a professional triathlete for Great Britain after winning the World Championships twice as an amateur. So I think we have no one better to talk to us about form in running this evening than Parys Edwards. So Parys, thank you for your preparation for this evening and for giving up your time. We're really, really looking forward to you engaging with Lauren in this, what is to be an outstanding seminar. Lauren completed her podiatry training at the University of Johannesburg in 2011, and she's been in practice at Netcare Waterfall City Hospital since then. She soon established a very good reputation, and as a result, I made sure that I poached her for Waterfall Sports Orthopedic Surgery, where she now runs the podiatry department and sees, again, a spectrum of athletes. And that's because of her interest and intense study of the athlete, of biomechanics and injuries. And on top of that, she does surgery on the foot and nail bed in particular, and she has an interest in wound care. So we've really got two outstanding presenters this evening. They're going to tag their presentations, and I think we're in for a very interesting evening as they take us through running, form and function, and hopefully answer a lot of the questions that we as professionals have, and hopefully those of you that are athletes have as well. So Lauren and Parys, I'm going to mute myself, turn off my video and hand over to you. Thank you very much.
Great. Thanks very much for that great introduction, John. Let's share screen. Cool. Parys, are you unmuted?
I'm not unmuted. Thanks. I'm unmuted.
Welcome, guys. Tonight we're going to be doing running.
Oh. Yeah, the music was really loud. We got it working there, Lauren.
Yeah.
We couldn't play that music earlier, guys. You can tell we're better with patience than technology.
Technology is not our thing. But we've done pretty well so far.
Okay,
so we've introduced ourselves already. One of the things that we wanted to highlight in this workshop was how podiatrists and physios need to work together to optimize treatment of our runner patient. And one of the first questions that we landed up asking was, what does running mean to you, and specifically to your patients? If you're a runner, you're in the runner mindset, you're able to relate to your runners a lot easier. But runners are the group of patients who really want you to identify with what they are doing, from everything in running, to psychologically how it feels, to the training, to the injuries that they've had, etc. So this is just something to keep in mind. Tonight we're gonna start off with the basics.
Yeah, so I'm going to introduce
take over.
The gait cycle. Yeah, that's cool. All right, so to help our runners, we've got to understand what running involves. Here's a lovely graphic of the gait cycle. A full gait cycle is from the initial contact of one foot to initial contact of the same foot. Okay, regardless of the speeds, the periods of acceleration and deceleration during running, referred to as propulsion or generation and absorption. Looking through here from initial contact into stance phase, you've got the absorption phase, past mid-stance, a propulsion phase to toe off. Then you go into a double float stage. And I always tell my runners, think about it. When you run, you've got 1 foot on the ground, double float, 1 foot on the ground, double float. They're only ever touching the ground on 1 foot. And that's really important from a functional point of view in terms of what's their balance like and what's their control like on one leg. And later on, I'll show you why I hone in on this, because I believe that the strength work to correct a runner needs to be functional. And a lot of the strength work I give is on one leg. So from toe off, you're into a double float phase where that leg is in swing mode. The other leg goes into a stance phase. And then, of course, by the time you in terminal swing, you're touching down on the next leg. So the next slide actually is another lovely graphic, which starts pulling in exactly what I was showing you before in terms of what the gait cycle is. Just note that a stride length is the distance between the initial contact of 1 foot to the same foot. Step length is the distance between each foot, so left foot to right foot. I do think when you're looking at stride length on Garmin, it's telling you left foot to right foot or right foot to left. It's not your whole stride length. So that I noticed. Also with this graphic, you can see that the center of mass will decelerate horizontally during stance phase absorption, and they'll be propelled up and forwards in that stance phase propulsion. Okay, there is some vertical oscillation that happens. We don't want too much of it, but it is essential. So what does the muscle activation look like? We're not going to go to the next slide yet because I've got a beautiful graphic of all of the muscles except glute medius. So we're going to keep this graphic on, and I want you to just watch this, and we're going to talk about glute medius, which for me is probably the key player in terms of running. So in the absorption phase, the role of glute medius, it's in initial contact through to stance. The hip is adducted, adducted, all right, in stance, because the ground reaction force falls medial to the hip joint. So glute medius works eccentrically to control this. And when I see a weak glute medius eccentrically, we'll see a contralateral pelvic dip. So the stance side hip will move out, the free side hip will move down. Okay, this is probably the single most common thing I see in terms of a strength deficit in my runners. During propulsion, it has a concentric action to abduct the hip, abduct the hip, and it contributes to the power phase. So note, the hip is in adduction in stance, abduction, and swing. Okay, in the coronal plane, this movement with a little bit of lumbar pelvic motion is almost reciprocal to the motion of the head and shoulders. And the control between these two is one of the most important mechanisms for decoupling the intense loading that comes up the lower limb to the head and the trunk. And it's important for balance and equilibrium to be maintained. So not only are your glutes pushing you forward, controlling the pelvis, but there's the control of these, the movements in the coronal plane. Your running should really be a sagittal plane movement. You want everything to take you forward. You want all your force to drive you forward. You don't want to leach it sideways. So when glutes aren't working well, I see a big efficiency deficit in terms of their energy taking them sideways. So next slide. We've got a nice infographic here with the muscle activation. It's a pity it's not a bit clearer, but you'll get a good idea of when the muscles come in and what they're doing. So starting with the hamstrings, they work eccentrically to decelerate the tibia, slow the knee extension just before initial contact. And then they help extend at the hip and flex at the knee in the second half of swing. Note, this is a biarticular muscle, and there's a very important role for all the biarticular muscles in terms of the run action. Your hip extensors, predominantly we're talking here glute max, will decelerate the hip prior to initial contact and extend the hip through stance. I call this hip drive. It's a really, the good runners, you'll see they've got superb hip drive. And it's something that I often find I need to work on to improve the run efficiency in a lot of the runners I see. Rectus femoris, we're going to discuss this separate to the quads because it's biarticular. So it prepares the limb for shock absorption during stance. And there's an eccentric action to prevent excessive knee flexion just before stance and into stance. There's also a powerful action mid-swing as a hip flexor, and it has an eccentric action down at the tibia. So it's working in two different ways, one at the top joint and the next joint below. Again, biarticular muscles, it's really when you get your head around it, and you can see if there's a deficit in one of the muscles, why it has such a big effect on the gait cycle. Quads, they act eccentrically before initial contact to limit knee flexion. They're an important shock absorber, and they also act concentrically to generate knee extension in the second half of stance. Your gastrosoleus are a powerful plantar flexor of the ankle, and they assist with knee extension and stance. And the more knee extension is, the more powerful the action on the muscle. It's another important biarticular muscle. And then your tib ant works concentrically to dorsiflex the foot for clearance and swing, eccentrically to control lowering of the forefoot to the ground, early stance. So if we think about some further gait considerations, next slide. This actually gives you quite a lot of the information in terms of the role of the arms. They help the runner maintain a more constant horizontal velocity. They counterbalance the rotation through the lower extremity. Think about the soft tissue we're dealing with here. Your main sources of impact force: Achilles, tendon, plantar fascia, quads mechanism, hip abductors. And then your main sources of power generation. You've got your hip extensors during second half of swing and first half of stance, your knee extensors, hip abductors and ankle plantar flexors for the propulsion. So that hip extension, knee extension, ankle plantar flexion is termed triple extension. And that is what drives you forward. And when you get that right, which miraculously I've done in that picture there, that's what looks so good on a runner. And so many runners don't push themselves forward with their posterior chain. They try and pull themselves forward from the front. But if you're working using your glute max, your hamstrings, and you've got control on the pelvis in stance, you can generate this beautiful position of triple extension to drive yourself forward. I think that is all I wanted to say on there. Before I carry on with this though, just remember your biarticular muscles, rec fem, hammies, gastrocs in particular, they act as an important energy strap, transferring power from one joint to another. Or as Jacobs et al. So beautifully summarized, they transfer energy between body segments by the biarticular muscles, contributes to energy efficiency. So again, if one of your muscles isn't up to scratch and you're compensating in various ways, it just changes the whole efficiency of the runner. And for me in particular, I want to make my runners very efficient, improves their run form and their speed. When my runners that say to me, Parys, no matter how I train, I don't get faster. It also reduces the loading, adverse loading, and then the injury risk. So if we put this all together, what would an ideal run style look like? This has been summarized nicely for us by UK Athletics. Tall posture, not too flexed from the trunk, relaxed shoulders with an efficient backwards arm swing. And I do tell my runners, like sometimes I will cue them for their arm swing only when it's impacting the lower limb. It is hard to change your arm swing. I know that because I had to change mine, but it's one of the important parts of making overall the kinetic chain work well when you're running. The foot strike needs to be close to the center of mass. With your sprinters, your foot strike, they're always a forefoot striker, and their foot strike is under the center of mass. Endurance runners, the foot strike is ahead of the center of mass. I don't change someone from being a forefoot to a midfoot or a heel striker. I don't mind how they're striking, but I want that lovely vertical shin. Mo Farah is the best in the business at this. You can see he's got that contact point right under his knee. He's got a vertical shin, and he's got some lovely flexion in the knee. So his quads are working beautifully to shock absorb in that initial contact. And you want minimal lateral movement. So no medial collapse, either at the hip, at the knee, at the foot, because now we're seeping force sideways and we're overloading tissue in a way that it shouldn't be overloaded. So with this in mind, by the way, two of the gurus that I love following, for anyone out there, Tom Goom is exceptional. He calls himself the running physio. He's based in the UK. James Dunn, he's got some fantastic stuff on YouTube. I love their work. For anyone looking for inspiration, a lot of my information I get from these two guys. So with this in mind, considering the gait cycle, considering what we're looking in terms of an ideal run style, we presented a case study for you, and it's actually Lauren's running. So I will let Lauren introduce herself, and then I'm going to talk you through, well, Lauren's going to talk you through the foot assessment that she did on herself. I will talk you through the biomechanical and kinetic assessment I did on her, and then I'll show you the run videos I did with her. And then we present the whole thing in terms of what we're looking at is their function without form.
So I'm not a runner by any chance, but it was just easy to use me as a guinea pig because of all the work that it entailed. So we're looking at a 37-year-old female beginner runner, right knee patellofemoral syndrome with a left hip glute impingement pain. We're running 5 to 10 Ks per week. The goal is a pain-free 10 Ks per week. So we are looking today at the podiatry examination, which would be non-weight bearing as well as weight bearing. From a physio perspective, we're looking at the biomechanical assessment, kinetic assessment, and run analysis. Management from a podiatry perspective is orthotics, shoes, and I've put socks in. I'll mention why later. Socks are important, people. Physio management, flexibility, form correction, and functional strengthening. Right, one of the things that we wanted to, as a light bulb, keep in the back of your mind, this should underpin a lot of your examination when you're looking at a runner, particularly who has an injury. When structural components of the foot or lower extremity are placed under more stress than they can withstand, the result is damage to that structure. And this is the tissue stress theory. There's a lot of great stuff that Kevin Kirby has put out on this if you're interested. Right, so from podiatry, we're looking from a cause perspective. The goal is a mechanical and therapeutic treatment plan. As a podiatrist, we are here to have a look at the bones of the issue, if I can put it to you that way. What are the mechanics from a joint perspective that are happening on the lower limb? How can we reduce pathological loading forces on injured structures? How can we optimize overall gait function, prevent other pathologies from happening, and improve performance? We're going to be looking at non-weight bearing versus weight bearing examinations. Our non-weight bearing examination consists of, it's dead simple. Range of motion of the joints. Do we have an adequate range of motion? Is there a limitation anywhere? A limitation can impact general function. Do we have an ankle equinus? Gastrocs versus soleus, which one is tighter? If there is a true ankle equinus, that has to be accommodated. Subtalar joint axis location. This is one of my light bulb issues that I feel only like podiatrists love to put attention onto this. It's one of the main joints that we deal with. We feel that it is the gateway to the foot. And we're going to do a little sidebar on that subtalar joint because I think podiatrists are some of the ones who only look at this joint. Right, what bone in the body has no muscular attachments and only ligament attachments? Any guesses? The talus. Talus makes up subtalar joint with a calcaneus. This is a very, very important joint. It is a triplanar motion joint. It's the gateway to understanding abnormal tissue stresses within the structural components of the foot. It's the first joint in the human body to have a moment when encountering the ground reaction force. It's pretty important. So one of the first things that I do in my non-weight bearing examination of a patient is, where is their subtalar joint axis? Is it sitting on its neutral pivot, or has it been deviated medially or laterally? You can have a look at both of the slides of what it looks like in terms of supination versus pronation moment. My best is that patients will come to me and they're like, oh yeah, I pronate. And I'm like, brilliant, you need to pronate. The degree is, the question is how much? Are you pronating too much? Are you supinating too much? We want an equal seesaw balance of both of them. Okay, so what happens when the axis is not on its neutral axis? Is it medially laterally deviated? What abnormal stress can this create in the rest of the chain? Okay, Kevin Kirby again does great stuff on this in terms of locating the subtalar joint axis as well. Right, so our runner, me, we're having a look at when we did our non-weight bearing examination, there was normal to hypermobile mid-tarsal joints. Dorsiflexion was just 10 degrees, so there was no definite ankle equinus. Plantar flexion was normal, and the subtalar joint on both feet was medially deviated. In terms of our static, there's some sound on this, sorry. The windlass mechanism was delayed on both feet. Post-tib was normal. Glute activation was there, but it was weak. Supination resistance was high, and there was a tibial torsion. There was a tibial torsion that was present. Okay. So dynamically, I do pressure plate and video gait analysis. I find that my pressure plate is a fantastic tool for giving me great detail in terms of toe off, heel strike, force progression, etc. So when we're looking at this gait cycle, heel strike, foot loading or mid stance and toe off, is there genu valgum, genu verum, and what is the hip stability like? You can see that this is what my pressure plate looked like. There is an increased pronation moment which gets stuck on the forefoot. I can't slow it down, but if I talked you through the pressure plate movement, you would see that it is stuck in the rear foot to where it finds the path of least resistance going forward onto the forefoot, where you'll often have your too many toe sign, which I'm going to show you next, and a twisting off of the forefoot to clear the foot going forward. Okay, so looking at the gait video, I'm going to play these all at once. You can see from the front, from behind, okay, and then you can see the more in detail one. When we're having a look at in detail video gait analysis, I'm having a look at each foot individually. We are having a look at, is there a navicular drop and drift? Is there a drop in the MLA? Do we have a genu verum or valgum? You can see in my case, there's a bit of a genu valgum. And there's a too many toe sign. As you go through onto the next foot, you can see again, too many toe sign, not as much a knee dip as the other side, but there is definitely still a knee dip present, navicular drop and drift, and a rear foot varus as well. Oops. Oh, there we go.
Okay,
yeah.
Perfect. Right. So there is a lot of overlap, guys. Well, there's a bit of overlap between what Lauren will look at, what I will look at, and there's definitely specialist areas. My biomechanical assessment involves exactly what I've shown on the screen. I look at the lower limb alignment. What's their straight leg raise? So what's their hamstring length? Is there a leg length discrepancy? I pick this up a lot. The Thomas test, which is the second from the right photo on the top, looks at your flexibility through the hip flexors, particularly iliopsoas. And then I'm also looking at what's the bend on the knee there. So have they got a tight rectus femoris? Remember, a tight rec fem, which is an important biarticular muscle, changes your run economy. And then if the leg pulls out in Thomas test, we know that the ITB is tight. And that again will change the loading through the limb. Knee to wall test, that's the top right photo. I'm just looking at the ankle dorsiflexion range. Lauren is very mobile through here. I do Craig's test, which is the bottom left photo. I'm just looking to see if there's any femoral anteversion, retroversion. And Sam, again, that middle picture on the left, I'm looking for lateral tibial torsion. So for those not familiar with this term, where your patellar tendon inserts on that tibial tubercle, that is sitting slightly outside of the midpoint of the kneecap. I've got my fingers on the kneecap. I've got a finger on the tibial tubercle. So she has got some lateral tibial torsion. And this alignment, you're not going to change. Someone is born with this, and they will most often like to run slightly toed out. Because when their feet point out a bit, their knees point forward. If they point their feet forward, their knees squint together. So if I see someone who's a preferred toe out runner, I want to know, is it because they've got lateral tibial torsion? Is it because they've got some rotation at the neck of femur? Or is it because actually it's a balance strategy or a fixing strategy? And then the last thing, I haven't shown a photo of this because Lauren's covered it in much more detail. I do look at the foot type. Is it a flat foot, pes planus, a very high arch foot, pes cavus? Where are they got calluses? Have they got a Morton's toe? You know, where on the foot are they going to struggle with some loading? So moving on, I do a video analysis of some movements. So the biomechanical assessment is static. I use, it's now called OnForm. It was in the beginning UberSense, and then it was Huddle. There are other video apps out there, Coach's iPlay site, you can see those. And then I'm assessing static balance, a standing knee lift, lunges, lateral step down, standing leg swings. And then I don't video the calf raises. I'll show you that in a picture. And then I also video the runner barefoot and in their trainers, usually at their long, slow pace. When they run fast, they recruit more muscles, they run with better form. Remember that the faster we go, the more towards a forefoot strike we'll get, and the more we'll bring our center of contact point under the center of mass. So if it's a comrades runner, I tell them, run at your comrades pace. That's what I want to see. I prefer to video them outside because the treadmill is quite forgiving. On a treadmill, you lift your legs and the ground moves. So a lot of the issues that I see outside are slightly dampened on the treadmill. That said, I do compare them both. So thinking about the video assessment with Lauren. Now I've written quite a big screening tool. I wrote a screening tool. I document, I've got my measures. I know exactly where I'm going with them. So we're going to look, the video on the left is her balance drill. So with the balance drill, first of all, do you know how many runners can't balance on one leg and they're only ever touching one leg at a time? I challenge their balance by bringing in the arm movements that you can see. And then I bring in, I shift their center of mass by getting them to do toe touches. I'm checking if it's a relaxed performance. Are they wobbling? Do they wobble and touch the floor or wobble and hop? And can't maintain their balance. And I'm also looking for fixing strategies of the face or a very rigid foot. So all my movement tests are barefoot. And I'll score this and I'll get an idea what's their balance like. Lauren's balance was actually pretty good. There was a bit of wobbling, shifting on the foot, but she didn't lose her balance. It wasn't too bad. Strength is the issue, and I'll show you this later. Standing knee lift, next video on the right. So they just, in stance, I get the arms up, they lift the leg up. Oh, I forgot that I'd done this a bit slower for the talk at the WiSH conference. So I'm speeding through these a little bit quicker. Does the leg lift straight? Does the hip hitch? Does the trunk shift sideways? Does one arm sit lower than the other? Is there any foot fixing strategies? Okay, and straight away, this is the easiest strength test I do. And if I see issues here, I know I'm going to see some issues when they're running. This should be a very easy test. But you've got to hone in on the specifics because you'll miss things. The body has a superb capacity to cheat and to compensate. So I'm looking at a lot of things in quite a lot of detail when I assess that, but pretty much looking at alignment, especially at the pelvis, overall on the trunk, and then are there fixing strategies, what's happening at the foot. All right, we can actually move on. I won't play that through like the full video like I did at the conference. The next test is a dynamic lunge. So videoing from the front and the side, Lauren lunges forward and you can see straight away, we're starting to see a loss of alignment in that coronal plane. I'm looking if the knee moves forward. Yes, it does. Does the pelvis tip sideways? Yes, it does. Do the hips move back in the lumbar spine arch? I won't show you from the side, but you're seeing if there's a fixing strategy, your glute max should work to push you back. When that's weak, you start to use your back extensors for that. Do the shoulders initiate the movement? Same again, compensating for your glutes. And are there any fixing strategies? And Lauren there has facial fixing. So she's pursing her lips. Naturally, her body's saying, this is hard for me. And on the left side, her alignment is a little bit better, and you'll see her form when she's running is better on the left than the right. So she's weaker on the right. And then that facial fixing, I'll tell you a story later if we've got time. It is significant. If they're fixing strategies, if she purses her lips to achieve a movement, if she goes running with her mates and she's talking, she's not got her fixing strategy. So it affects her more than you realize. Next step, test, should I say, lateral step down test. So here, I don't cue them. So straight away, I want to work out, what does the body think is the easiest way to achieve this lateral step down? Is there a trunk lean to the side or some side flexion? Does the pelvis dip? Does the knee drop in and knee valgus? Is there some medial arch collapse at the foot? And are there any fixing strategies at the foot and the face? All right, and we're definitely seeing a weakness right side more than left with the lateral step down. So straight away, when I've done the movement test, I can often predict what I'll see on the runner. So moving on, because we're short of time, standing leg swings. So this is the video on the right. I keep them on the step. I like this because it incorporates coordination, balance, and some functional strength. You're on one leg. So I'm looking to see, does the trunk tilt sideways? Does the pelvis rock forward or back? Is the balance poor? And any fixing behaviors or a jerky non-fluid movement? Lauren actually performed this quite well on the left. It is her stronger side. She's still fixing. So she's, and we're looking for these tiny little things. There's a story of an elite sprinter whose hamstring kept breaking down. She was as strong as an ox. They got her back in the gym. And the only thing they noticed is that she had a facial fixing when she did her strength work. And I don't know if you've watched sprinters, their faces are so relaxed. They put her back in the gym, and all she did is the same strength work without a facial fixing strategy, back on the track, no hamstring problem. That is insane, guys. You just wouldn't think about the effect of something simple like a foot fixing. If you're foot fixing and you claw the toes, you can't run on a fixed foot. So if I see a person doing that in the drills, then I know they've got a weakness that they're compensating for somewhere. And then last test, this isn't a video, it's a single leg calf raise. I perform it from the floor. They just put fingers to the wall and I get them to go, well, it should be to fatigue, but actually I stop them at 30. I haven't pulled that number out of any research. Anecdotally, I can tell you if they can hit 30 on each side, is one side easier than the other? They haven't got a major calf strength issue. So that is my movement analysis. So with that in mind, if we're thinking about what would we see in terms of, are there common predictors for running injuries? And there's a lot of research out there. You can screenshot these and take the references if you want. And we do see that they picked up that forward trunk lean, contralateral pelvic dip, and that hip adduction, too much hip adduction in mid stance, big predictor and often common in runners. And a lot of the researchers do say it's quite hard because by the time you're assessing an injured runner, it's chicken and egg. Were they already doing it and they got injured, or did they do it more because of the injury? Nonetheless, I can vouch for this anecdotally. These are the things I see in my runners when I video them. And that also the injured runners had increased knee extension, ankle dorsiflexion at initial contact. So that's your absorption phase. And there's a lot of eccentric action required there. And so you will start to see things with that. And we see this with Lauren, and I'll point it to you later. And the research shows that the contralateral pelvic dip was the most important variable for predicting injury status. I would agree, it's the most common thing I see. And for every 1 degree increase in pelvic drop, there was an 80% increase in the odds of being classified as injured. Guys, that's huge. I mean, you can change that. It's functional strength work. And then you've got a significant improvement in terms of reducing your injury risk. Also, the next slide, this is a lovely graphic, and I will show you the video of this runner. She's just been my most superb patient in terms of taking on board what I recommended from the running. At her initial assessment, she had a massive overstride there. And for me, this is probably one of the biggest things that increases the loading up the limb. And I cued her to improve that. The bottom still, and I'll show you the videos, they're only 2.5 weeks apart. And I said to her, how's the running feeling? And she said, it doesn't feel so good. And I said to her, it doesn't feel good because it's not your habit yet. It looks amazing. And so reducing that overstride for me massively decreases the braking forces, improves the economy, and reduces the adverse loading up the limb to reduce injury risk. So considering your run analysis, I'm going to take you through the videos of Lauren. These are some of the things I work on. I do have a crib sheet that I work off, and so I don't forget things. But I've been doing it more than 5 years, videoing and assessing people specifically with all these things in mind. That said, I still score things on a little screening tool that I've developed so that I don't miss anything. So if we look at Lauren from the back, I'll let her get into her stride. So She's going to take 1 or 2 steps, and then we're going to look at right stance. So now she's loading into right stance. Her foot position, she's in her hokers with a orthotic that she's made, and she'll talk you through this. And I'm happy that her foot position is neutral. I can see a few of the toes, not too many, but she's not collapsing in that trainer. But knee and hip position. She is getting a knee valgus and she's getting a slight contralateral pelvic dip, and that as she loads it, the stance side hip moves out, the free side drops down. This is a functional weakness of glute medius. She's got to compensate with some slight trunk side flexion. She overcompensates and that right shoulder dips down. If we take her into left stance, the alignment is slightly better. And I'm happy with the foot position. In fact, there's less of the more toes sign. But the knee, you're still getting a medial knee collapse. You're still getting a contralateral pelvic dip. And instead of a big side flexion, she's actually side leans off to the left a bit to keep herself balanced. Otherwise, she'll fall over. Watch this right elbow as she goes into right stance now. She's hooking that round. She's using her lats on that side. She's fixing. And because she's weaker on the right side, so her body feels it and intuitively will make a compensation. That is a very, very brief summary. I spend about, 10 minutes on it, or 5-10 minutes on the videos. I play them forward and back. I look at all the moments and I score the things. But straight away, we can see, looking at Lauren from the back here, we've got some functional strength deficits, okay? And for sure, the bulk of them are in stance, which would fit with her patellofemoral pain, because her quads is going to be loading up that patellofemoral joint, working to try and shock absorb and help her in stance. Front video. From the front, they are a bit far away until they get a bit closer. I look at head position, shoulder height. The hands, are they relaxed? What's the arm swing like? And then I study the knee and the pelvis. You can see that right elbow flicking out. Right leg coming forward. Let's look at that initial contact moment. Even from the front, you can see there's a big dorsiflexion at the foot, a bit of an overstride. And now from the front, you can see the knee valgus, that knee falling in, and the contralateral pelvic dip. Yeah. The knees actually brush together, and that is glute medius. She's losing energy sideways as well. It's not ideal. All right, and you've got that side flexion because she wants to stay upright. Left stance, same as from the back. We're getting that medial knee collapse. Stance side hip moves out, free side drops down. Her overall alignment is a bit better. She is stronger on the left than the right. We've got quite a few videos to go through, so I am going to proceed. From the side, we see different things to the front. So I like to watch their posture overall, their head position, their arm drive, their hip drive, what's happening at the knee. Is there an overstride? I look at the overstride when they level with me. So I'll get you there now. Lauren is a heel striker. And like I say, I'm not going to make her a forefoot striker. What I don't want is a contact point well ahead of the knee with a very straight knee. Lauren's actually got some bend through the knee. Her contact, there is a slight overstride. You can see it's not a vertical shin, but she's actually got quite good knee drive. And knee drive, you measure it at toe off. You're looking for parallel lines between the front and the back leg. Her knee drive's not bad. Look at that. She's got almost parallel lines. So that's why from the side, it actually looks quite good. That said, there's still areas that we can improve in terms of her efficiency. So that's right stance from the side. And then knee drive with the left knee leading forward is pretty good. So there it is, those parallel lines. These apps are amazing for I can draw lines and measure things and take screenshots, which is fantastic. You can spend hours of time on this, guys. Contact point, heel striker, a little bit of an overstride. She hasn't got a vertical shin, but she has got some good flexion in the knee. So I'm happy with that, but a very dorsiflex foot out front. And so there's things we can look at from the side. She's also got, I think, too much of a forward trunk lean. So she's not fully utilizing her glute max to drive her forward. Her hip drive is compromised. And it's because her glute max is saying, not me, not today. Thanks very much. Okay, I can't remember if we switched to you. Yes, we switched to you, Lauren.
Yeah, so what do we do now? How do we dynamically affect our findings to create better function?
When I was a young boy living in the city.
It's supposed to be run, 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 run.
That's how everyone wants to fix their running, Lauren. They just want to run.
Exactly. It's a great tune to run to. Right, interventions. The challenge is runners just want to run. And that's, Parys will dip into that later. From my side, so we did an orthotic. obviously.
Yeah.
But let's understand what an orthotic is. It's an in-shoe medical device. It alters kinematics of the foot and the lower extremity. It manipulates the moment of acting across joints of the human locomotor apparatus. We're trying to decrease the pathical loading forces on structural components during weight bearing. There's a reason why orthotics are in a podiatrist and an orthotist scope, specifically a podiatrist when it comes to prescriptions. And I say this because one of the things that I highlighted at the workshop is I had all the samples of my materials that I use to manufacture orthotics, which we use in EVA. And I threw all these samples around. I said, right, who can tell me, those who are not podiatrists, who can tell me what density of material is going to work on me with the information that you have? And no one could tell me. And a lot of people came to me afterwards and said, you know, I didn't actually understand that there was this much analysis that went into the manufacturing of an orthotic. Okay, we need to go back to our examinations. We need to look at role and function, rear foot versus forefoot manipulation, and the effect of the orthotic on the open chain kinematics. In my case, with what we were seeing in terms of a medially deviated subtalar joint, so a pronation moment that was too long, there's a few ways that we can manipulate this in an orthotic. I did a medial Kirby backskive, which is an, I don't want to get it wrong now, but it's traditionally we would make this modification onto the cast. Digitally, you can actually see this is a picture of my orthotic on the left-hand side. You can see the yellow circle is where I put in this medial wedge, and it's along the subtalar joint axis line that I've already measured. And we increase, so we put in that wedge and it's at about 15 degrees. I have put in a fascial groove for sagittal plane facilitation. Sean Pincus does. Stay tuned for hopefully a talk later in the year by Sean and John on plantar fasciitis, and Sean will talk about fascial grooves as well and sagittal plane facilitation in terms of that fascia. You can see some of the research that has been done, which is also Kevin Kirby. He does great work on this. He's the one who developed the this backskive technique on the orthotic that we use, and it's really nice because this backskive is something that is it's actually very well tolerated compared to an outside medial wedge that's added to the orthotic. Running shoes. We're not going to spend too much time on this. Everybody loves this topic, but I'm not going to, because how long is a piece of string? We're going to talk about the two shoes that I have run in and that I have used. They are both stability shoes. I've used the Hoka and I've used the New Balance 860. It's the Hoka Arahi and the New Balance 860. Both of them are pretty good, stable, like as in firm stability shoes. Okay. The difference between the two of them is that the Hoka has a 5 mil heel to toe drop and the New Balance has a 10 mil. The heel to toe drop can have an influence on knee flexion angles at heel strike. But the interesting thing about the Hoka is that it has a meta rocker inside. And John teases me a lot because he says that everybody who comes to me gets a scanogram for a leg length discrepancy and they're all into a Hoka. The Hoka is just a fantastic shoe that actually hits so many birds with one stone. And I'm going to show you the difference between the two. Having said that, that's not correct for each patient. Okay, so we're looking as this is the platform for the orthotic. So your shoe has to be a platform that enhances the function of your orthotic, okay? Because the influence of this dynamic in terms of open chain is glute activation and a knee flexion angle change, which changes load. If we have a look at what happened with me in the two different shoes, you can see on the two pictures on the left-hand side, have a look at the position of the Hoka, the left foot in the Hoka versus the left foot in the New Balance, which is in the red. You can see that there's slightly more medial collapse in the New Balance, interestingly, and not as much in the Hoka. You can see the same on the right foot. I found this very interesting because when we often fit a running shoe, one of the main things that I'm going on is fit and feel. Okay, how does this shoe fit? It must fit correctly, and the patient must feel comfortable. When I went into the New Balance, it's my most comfortable fit. Okay, but the quality of run that I get in the Hoka surpasses it. So when I tried these two shoes on initially with exactly the same orthotic in it, I found that the quality of run I had in the Hoka was better than the New Balance. And this is just a personal preference for me. It changes for each patient, and you'll get some patients who are brand specific or who have got into a shoe and they love it and they're not changing it. So if you've got a shoe that is okay, like if, so for instance, if I came with a New Balance 860 and I was like, this is my shoe, you know, let's try and make this work, we would still work. I'm still able to run in the 860. I'm able to still get the same amount. It's just not as, the quality of run is not as good as the Hoka when you compare the two. Okay, socks. I wanted to put this in because this influences our run more significantly than you think. Would you run in a shoe without a sock? It's an important question to ask because people don't think about this. Why would you not run with and triathletes, you ignore this question because you run with
for less than 10K. I think triathletes over 10K, just put the socks on and avoid the blisters. But there we go.
Because it's worth it, right?
Yeah, totally.
It's worth the 10 seconds of putting the sock on.
100%.
So you would not run without a sock. It feels weird, number one, and believe it or not, your feet are habitual things. They like to feel a specific way. If they don't feel that way, they immediately go, hey, I don't think I'm comfortable in this. I'm not quite sure what's going on. Sock is critical, okay? Its main role is protection of the foot. It's moisture management, which ties into friction control, and it's an important part of the fitness shoe. I can take a patient from blistering to non-blistering with a sock. If they're in the right shoe and we're just struggling, we've got a hyperhidrosis, they're really sweaty, they're running in an awful sock that does not fit well, it bunches up, it's stretched out, it doesn't have any kind of tight fitting feel to it. They get a blister and they come back to me and they're so frustrated because the blister ended their run and they can't run again. Sock is really, really important. Some of my favorites are Falca, the Stride, and the Belega Ultra Glide, as well as if you're looking for a thin all-round sock, the Njinji is amazing, particularly for a very wide pes cavoid foot. Spend some time looking at socks the next time you're in a store. Try some on. You will be surprised.
Yeah, so true. So important to get socks right. And I found when I was racing in a cold climate to racing in the humidity of Asia, I had to change which socks I used. Like I say, I didn't use socks for Olympic distance and shorter, but I certainly did for halves and fulls. Right. I'm going to present to you the comparison barefoot to trainers, Lauren's and her Hokas with the orthotic. I always look at the barefoot on its own as well as the trainers on its own, but we were short on time, so I'm doing them together. If we look in mid stance on the left, you can see the calcaneal E version, much better alignment through with the orthotic and the trainer supporting her. The hip dip is better, but her is not better, but I think the knee and foot alignment was slightly better. So considering the trainer and the orthotic are doing what they do. Sometimes, and particularly when I'm looking from the side, when I video someone barefoot, their run form is better because they activate their core and they don't plonk down on their heels. Lauren is not the runner that I would cue her to imagine she's barefoot. Right stance, big mini toes sign, so external rotated foot, less so in the trainer, much better position through the foot and the low end in the trainer and orthotic. There's a clear improvement in the alignment. The hip position and alignment, medial knee drift, yes, they're still there, but I think less so. You can see if you compare, I think it's just a fraction, there's a tiny gap between the knees in the trainers, there wasn't at all. And then look at her narrow stride width barefoot. So much narrower stride width. So this is one of the issues, and I'll talk you through with the references where how much adverse loading and narrow stride width introduces. Difficult to correct in my trail runners because they're often on a single track. But I mean, you look at those photos. You've got a line going up the outside of the leg. The foot is contacting underneath the midline of the body. She's going to have to make compensations for that. And the research shows that it does increase the impact up the limb. So she had a much more narrow stride with barefoot, which was also surprising. So like I say, I compare barefoot to trainers. I'm studying barefoot from the back, front, and the sides in all my runners. And occasionally I see better form, because if you were to stand on a driveway, on a concrete road, and think, right, imagine I've got no shoes on, you'll often activate your core, hold yourself taller, and you'll run lighter on your feet. So it can be quite a useful cue. It wasn't a useful one for Lauren. And so I played with a few other cues. And I hadn't mentioned it on the back analysis, but she had very much a narrow stride width. So one of the cues we started to look at, what if we just say to her, right, let's get your stride width, let's increase your stride width a little bit. It's a very uncomfortable cue, and I find runners do struggle with it. At the bottom, I've cued Lauren to widen her stride, so she actually ended up straddling the line. And when we look in terms of left stance, I think there's a slight decrease in the knee valgus and the contralateral pelvic dip, but I know that the loading up the limb will be less anyway. Right side, she struggled. Look at that. So bottom video, she's widening it, and actually she's super uncomfortable. That arm's popped out, the knee is dropping in. She struggled, and it's because the improvement wasn't there, because actually we need to start with strength work with Lauren. So if we bring in some functional strength work for her on her right side, then she'll be able to do the cue comfortably. That said, if she was actively struggling with an ITB, medial shin splints, I find that if they just widen it slightly, so I tell them, guys, you're not running with a horse between your legs, you're literally landing the foot under the hip, not under the midline. So they can straddle the line, or they can think about foot under hip, and they will change the loading up the limb. And it can be one of the most useful things, particularly for your ITBs. If you've got a runner, or you're a runner with a really gnarly ITB, just widen the stride width can be a game changer. It really can. So what else did we try and see? I cued Lauren for knee drive. Now remember, her knee drive wasn't bad, but she had an overstride, and I'm going to talk you through the three main reasons. Top video, she's running normally. Bottom video, I said to her, just slightly emphasize heel to bum. Because it's Lauren and she's a perfectionist, her heel is clipping her butt. And she's got an exaggerated run style with a bound. That said, do we see some improvements? I feel that when we look at the initial contact moment, it's so fractional though. There was a little bit of an improvement, but not a significant one enough in terms of the overstride and the lower limb alignment. So here we're looking at her, I'll compare them. She's out of sync because when she did cue her knee drive, she actually changed her cadence, everything. So I couldn't sync the videos and show you. I mean, there's slightly more, the foot is slightly more under the knee. She's got a slightly more vertical knee. And then same on the next stride, which you'll compare now. But look at this mid stance, beautiful knee. You look like Mo Farah there. And still it works, but the video, I would tone this cue down for her. And there again, I feel the contact point is a little bit closer underneath her. And she's got a little bit more bend in the knee. So it had its uses, but I would tweak this cue, and I find the video feedback so useful because a runner can't change what they don't know. So when they see the videos, they can change it. But look at this moment where we finished. Her posture is better. I did not expect knee drive to improve her posture. I thought that a posture cue would improve her posture, but wait till you see what that did. So we tweak the cues, and if they don't work, we change them. And what resonates with the runner, we use. So posture cue. This is hilarious. In the bottom video, I've cued Lauren to try and run tall. Imagine she's got a string attached to the top of her head, attached to a helium balloon, bring her hips forward. And it didn't help at all. When we had a couple of videos of these, and we actually had a chuckle. We called it her Phoebe running. If anyone watched that Friends episode where Phoebe's running, it turned Lauren into a bit of a Phoebe. It didn't even improve her overstride. It had less of an effect really than the knee drive, which was so surprising because her knee drive wasn't that bad to start with. So for me, this is not a cue. Her arm action was stiff. The knee drive wasn't improved, sorry, the overstride wasn't improved, and it just looked and felt awkward. So we would ditch this. And then again, I might look for something else where I say cue her just in terms of active, or don't even think tall, just keep the hips forward, or, you know, we could change the cue a little bit, but it definitely wasn't a helpful one here. And that's the thing, unfortunately, a lot of your runners will struggle with the cues because it's not their habit. And I tell them there's 4 stages. There's unconscious incompetence when you don't know what you're doing wrong. There's conscious incompetence. You've seen the videos, you can see what you're doing wrong. Then there's conscious competence. That's a big mouthful. They have to think about getting it right. And they Do that enough, think about getting it right, they become unconsciously competent. 4 stages. By the time I've done the video analysis, generated a run analysis report for them, taken them through the cue correction and strength work, they're already on stage 3 out of 4 because now they're unconscious competence. And if they drill it, now this, I have permission to share these videos. This is a runner who couldn't finish 2 Oceans Ultra in 2019 because of a really horrible ITB. I said to her, settle the knee down and then come see me. We did a run analysis. She had a ripper of an overstride. I mean, look at the overstride on the top video. So, and she was also functionally weak, that she had a knee valgus. So every step she took, her ITB was getting stretched. 2.5 weeks later, I got her back in, asked her how it was feeling. She said, not so great. It looked amazing. Look at her knee drive. So the knee drive on the bottom, she's nearly parallel lines. So knee drive cue worked amazing for this lady. And look compared to the previous one. I mean, ignore the lines on the bottom. I mean, that is inefficient running, guys. There's a braking force as her heel contacts. There's a braking force as the foot flattens. Now she's got to pull herself past that leg. It's so far ahead of her. So by changing that contact point, not only have I made her a more efficient runner, I've actually reduced the adverse loading up her leg. She struggled to break 6 minutes a K, was always injured. She's run a 47-minute 10K. Her comfortable endurance pace, 15 to 21, is sub 5 minutes, and she's had hardly any niggles and no ITB issues since. Absolutely amazing. So, I mean, this is an example of when if you dial it in so well, it absolutely. And she did a combination. She did everything that I suggested. The cues, she stopped running in a group. On her runs, she was cueing. No, I tell my runners, don't spend the whole run thinking about your cues. You'll run into a lamppost. Every 1 kilometer when they watch beeps, or every time they stop and start at a traffic light or whatever it is, they can go through their form check. And it might be one day they're thinking about their posture or their knee drive, or the next run they're thinking about cadence. Lauren's cadence is low. We didn't play with cadence effectively, and that I would, I have said to Lauren, if she's on the runs, to increase her cadence would reduce the overstride. And I think that would be one of the key things, because in my experience, an overstride is due to low knee drive, a low cadence, or a forward trunk lean. Trying to adjust the forward trunk lean didn't help. Her knee drive was pretty good, and it did reduce the overstride. And then last metric for Lauren to focus on would be increasing her cadence. I try not to get too stuck. There is a golden number for cadence. It's 180 steps per minute. Your very elite top guys, even those doing comrades distance, are often closer to 190. My golden number is 178. I comfortably, if I'm running well, I'm at a 178 step per minute. I see runners coming in with 140, 150, and they're going to overstride. I'm never going to bump them up to 180. They're going to go up by 5%. They're going to get comfortable there, and then they're going to go up by 5%. Once they're in the 170s, they find their golden number. But a low cadence is definitely a big predictor of increased overstride and adverse loading up the limb. And then from a strength point of view, so Vari, we looked at her knee drive cadence, and her, those were the main two. And I did a lot of strength work with her. And I mean, the bottom photo is her lunges. It's not so obvious, but she was actually cheating in all the ways possible, especially on the left, which was the left ITB. She had the knee drifted in forward, the hips dropped. So I could see why her ITB would get overloaded when she ran. And then in 2020, when I last saw 2022, I mean, even her lunge on the videos is better because her functional strength has improved. So she went away, implemented the cues, implemented the strength work, and she's running like a gazelle. And all her runners group shout at me because she's too fast for them. And I tell them, I don't care, I'll claim that one. So what would I be thinking about introducing? These are my favorite runners' flexibility work. There is a space for flexibility because if your range of motion is limited, you're working, particularly if you're desk-based or you're a cyclist, you're sitting all day and then you're sitting on a bike, or if you're a triathlete, and the time trial bike is even worse. Hip flexors for me, if your hip flexors are too tight, you're not going to benefit from a strong glute max. So here's my favorite stretches. I prioritize stretches because runners hate to stretch. So I'm not going to give them the sheet and tell them to do all of them. I'll tell them the most particular ones. And if I've got a run geek who likes doing all the stretches, then great. But I'll prioritize the main ones, and those are mine. In terms of 3 top tips for form correction. So knee drive, the easiest cue for that is to think heel to bum. I'm messing around on a treadmill with a friend here. I've cued her running. Treadmill's a lovely place to play with your run form, by the way, because you can keep a constant pace and you can think about it without getting hit by a car. And certainly you can see the change in her knee drive. 10-second video, screenshot, same pace, and I just cued her, heel to bum, heel to bum. You can also say to them, take your knees forward. Remember, it's knees forward, not knees up. Knees up is a very tiring warm-up drill. Knees forward, like you're smashing a pane of glass in front of your knee. And then look how that knee drive changed her contact point. So you can see even, and the treadmill is more forgiving. So you know that outside this will look even better. She's got a bit more flexion in the knee, and her contact point is closer to her center of mass. Slightly more vertical shin. It's not perfect, but it's better. And it even improved her upper body posture a little bit. You can't see it so much from the still, but on the video, it's very interesting. So definitely one of my big things, if they've got an overstride and low knee drive, we play with knee drive cue. Cadence. So it's counterintuitive because my runners are like, so you want me to take shorter steps because you want to increase your step rate without increasing your pace. So yes, you're taking shorter steps. And there's so much research, and it's listed here for you to see, that doing this will, I believe it reduces your ground contact force. So your ground contact time and the force. It'll decrease the load at the hip, knee, and tibia. It decreases the Achilles and plantar fascia load. It'll decrease your peak vertical ground reaction force and the necessary shock absorption that's happening at impact, at initial contact. You can see we get that the foot strike, again, second reference, closer to your center of mass, your knee flexion is greater, less dorsiflexion. I'm messing around at my home in Zimbabwe, got my nephew to video me, and I was just playing with cadence. And you can see that it's the top video, sorry, I'm turning over a bit quicker, and I've got a much flatter foot. I haven't got that big dorsiflect foot. I've got a more vertical shin. And I'm spending less time touching the ground and less time like staying there. I want to move forward more. It takes getting used to cadence, which is why I come back to the point. If you're increasing your cadence, please do it slowly. So you can use a Garmin watch. It'll tell you your cadence, or you can count it manually. Easier to do on a treadmill. 1 foot strike for 30 seconds times 2 is that leg per minute, times 4 is your steps per minute. So your mental arithmetic is going to improve with this. And then if you're on a 160, your 5% increment is about 168 steps per minute. So you're not even hitting into the 170s. Go up slowly, but you will certainly improve your run efficiency. It takes some getting used to, and it will help with an overstride. And then in terms of Schubert et al.'s seen here, it increases the leg spring behavior that decreases your ground contact time, increases the leg stiffness, which we want in terms of the initial absorption and propulsion, and decreases your vertical oscillation. Okay, so people that are running super slow, I'll often see they're spending too much time going up and down. We need some center of mass up and down, but not a lot. So I do look at cadence. It's one of the important metrics, and we play with it. And then I help my runner find their golden number. And then lastly, this forward trunk lean. I didn't actually have permission to share any videos, so I tried to demonstrate this ineffectively, but it felt so uncomfortable trying to run leaning forward, guys. And do you know how many runners I have doing this? They reduce their hip drive. They tend to throw the foot forward and overstride. So when I see a poor posture in terms of a forward trunk lean from the waist, remember, we can't run leaning backwards. We want to run leaning forwards, but not from the waist, pretty much from the ankles. And so that we get that full hip drive, stay tall. So posture is a big thing. It'll affect your breathing. It'll affect overall your kinematics, your energy straps, your energy chains. And it also affects how good you look. And I tell you, when you look good, you run good. So I am very intentional about pointing out postural stuff to people and correcting it when I can. In terms of balance, if someone can't balance on one leg, they're not going to run well. I have balance drills, so I literally get them to repeat the balance tests. Standing leg swing is the most wonderful balance drill. I love it because it also brings in the anterior oblique chain, just like when you're running, opposite arm and leg forward. And if they do it for 30 seconds to a minute, so I've said there are 10 sets of slow swings, but I often will tell my runners, listen, standing leg swings, timer 30 seconds or time a minute. Goodness, you can feel the standing leg glute working. It is a very sneaky way to strengthen the glute. So whenever I've got my runner on one leg, I'm making them aware of the position of their body, their trunk and their head, the pelvis, no dip, and the knee, no collapse and no foot fixing. If someone's struggling with their feet, I get them to do their strength work barefoot. Tune into what's happening with your feet, and you can wake those up and strengthen them as well. And Joanne Elphinston, she's got the most wonderful book in terms of core stability. A lot of the assessment techniques I learned from her. She's based in Wales, and she's got these foot drills, which if I can see that someone's just got the stiff, rigid foot, they have no clue what's happening through the foot, I'll wake their feet up, strengthen their tib post, and then wake up their neural chain with these body rotations. So it's important that we look at proprioception, your balance, and that if we maximize this, they'll minimize their fixing strategies and they will run better, bearing in mind they're always on one leg. A little bit of a dynamic example of some balance work. I've got 2 videos here. Next slide. Walking on your toes, a little toe tap, trying not to shift too much. I've got some weights to add in a bit. March drills. Oh, I love march drills. I've learned these from actually a guy called Chris Johnson. He's on YouTube, look him up. And if you can perform a march drill with control, super controlled and slow, your alignment will be better and for your running. And I tell my runners to do these as slow as possible. And there's all sorts of variations I can put in there. I can do that back toe tap. I can do a 2-throw. I can get them to go up and down onto their toes. I can get them to do a run arm action. So I really like functional strength work where I'm getting them performing movements, thinking intentionally about the muscle they want to recruit, what they're trying to do, and slowing it down. I have a little saying, speed hides need. If I see my runners performing the exercises quickly, they're using momentum, they're often cheating. And then I say to them, how slowly can you perform that exercise? And when you slow an exercise down, you will see where in the exercise you're struggling, and then you'll be able to correct it. Guys, I see so many runners in the gym trying to do the strength work for their run, and they're using the same cheats and compensations in their strength work that they do when they're running. So they come to me and they say, Parys, I've done the strength work and it didn't help. And I'm thinking, you probably weren't dialed into the compensations and the cheats that were happening. So it sounds pedantic, but I tell you something so important. Okay, looking at the glute medius. So the top line that you can't see there is glute medius to prevent that contralateral pelvic dip, femoral internal rotation. These are a couple of my favorite glute medius strengthening exercises, the wall press, in stance, 30-second, pushing the bent knee into the wall. You're getting an activation of the outside leg, glute med. We're keeping the posture up, hips level. Tell you what, you should feel the glute working within 10 seconds, 30 seconds to a minute of this is exceptional. It's mimicking that mid-stance position. If the runner feels this in their ITB or their hip flexor or their TFL, I change the exercise. I want them to feel it in their glute only. The aeroplane tips, it's effectively a mini, it's a mini arabesque. Here I might get them into only a 45-degree as opposed to the full arabesque aeroplane. And I see, can they control the hip position, because then their glute medius is working on the stance side. Crab walks, you will all know. I'm just going to talk you through, this is, I call it a single leg squat and reach. If I'm not allowing my knee to drop in or my hip to tip out, as I hover the back leg above the ground and reach with the opposite hand, remember, opposite hand knee, towards the bottle. Slowing this down, I mean, that is just a slow down run action, guys. And it's a body weight exercise. And there I collapse the knee and I drift the hip. I don't want that. So I get my runners to perform this in front of a mirror, and I'm showing them, listen, if you can get this slowly with control, you'll be able to get that stance position corrected with their running. Crab walks, by the way, the little video with the band around my feet, I keep constant tension on the band. So I find when people do side steps with the band and they offload it, they don't get their glutes queuing in. Constant tension on the band, wide to wider. And then they can actually, if you put your fingers on the front hip bone, your thumbs will be over your glute muscle, you can feel it working. Those are some of my besties for glute medius strengthening. Glute max strengthening. I've got a little glute max program. I love this. This is one of the few non-standing exercises, the hip drive on a step. You bend, you flex your top free leg to stop you doing a lumbar extension to achieve the movement. I'm performing it with a sandbag. I'm doing it quickly because I was going for dynamic rather than strength. The faster you perform an exercise, more cardio, the slower, the more the strength element. But that is hip drive. I'm recruiting glute max. The head must be relaxed and the neck relaxed, the head back, and I'm not overarching my back. So you keep that knee up. If they're not using a sandbag, they hug the knee. A single leg squat to chair on the photo on the left, such a sublime exercise. I teach them to squat double leg to the chair where the hip goes back and the hip goes forward. If when they squat, the knees go forward and back, it's all quad dominant and they're going to get anterior knee pain. So you learn to squat with the Swiss ball against the wall, drop the hips down, get a vertical shin. This is a glute squat. And I've cue them not to lose the lumbar position. So lumbar pelvic control. They can move at the hip without losing the control in the back. If your runners get back pain when they run, they've got poor lumbar pelvic control, and you can zone in on some of the exercises where they can recruit glutes without their back moving. And if they can do a single leg squat to the chair without plopping down that last little bit, and then they can drive up on a single leg, it is literally hip drive isolated to a strength exercise, and it's one of my faves. A couple of videos of hip drive.
Action.
Oh God, we haven't turned the sound off, don't worry. High step up, driving through the heel, eccentrically lowering, bum back. That last little bit, I just couldn't do it. So the higher the step, the more the eccentric control. Love this exercise. I'm trying not to let my knee track past my toe. Okay. The number of runners that are only quad dominant doing this exercise, honestly, it makes me want to cry. This is a very simple back lunge slider. I've got a slider mat under my toe, really eccentrically works the front hamstring. And I'm pushing up through the heel of the front leg. I'm aiming to sit into the lunge, vertical shin, guys. The number of, watch when you lunge or watch your patients, how many of them, the knee just moves forward and back. It's all quad dominant. They're just going to get sore knees and they're not improving their glute max activation and their hip drive. So 2 examples there of some great functional run strengthening work. Remember, train the movement and the muscle. And another classic example, if I could critique this, I would have had my band a bit tighter. So this I call the standing knee drive against the band. I would have kept tension on the band the whole way instead of offloading it. My standing leg, guys, is working so hard. My knee wants to fall in, my hip wants to tip. You can see I'm working for balance. And then depending on how much resistance you've got on the band, you can use a cable machine at the gym or a resistance band like I'm using. And you get a little bit of hip flexion work on the swing leg. Swing leg here, I'm getting a glute max and a bit of a hammy. I call this the scoot. Again, it's subtle, but the standing leg's actually working harder because you'll lose the alignment otherwise. You can bring in a run arm action. There's so many ways you can play with this. If you're struggling with foot clearance, do it on a step. A really lovely functional exercise in terms of glutes and then whatever else you want to bring in. Core work. So we want to think about, in terms of core, you want to improve posture, you want to maintain a central longitudinal axis. I love the Superman. I will often say to someone, a third full with water, a 500 ml bottle, the little stubbies, rest it between your shoulder blades. It's not allowed to fall off when you do the Superman. People shift side to side. As soon as you've got that bottle on and it can't switch, can't fall, you will feel your core switch on in a totally different way. You want to make sure they're not getting some scap winging, so they stay nice and stable through the shoulders. And then as they reach foot away from hand, they're not arching their lumbar spine to achieve it, and they're not tipping at the pelvis. And often just with the bottle there, they'll control the movement a lot better because they can't cheat. I call these dead bugs. I think this is a very safe abs activation because you have to keep your lumbar spine flat on the floor. I don't like sit-ups. I think that you just use your iliopsoas to sit up. And if anyone's got any lumbar disc issues, it just canes them. So opposite arm and leg, you can do any variation. You can just do heel taps with the knees bent. You can slide the heel out like I'm demonstrating there, or you could have a straight leg raise. And those are pretty hard. I'm demonstrating a pretty fun advanced exercise in the video. I'm bringing in some hip flexor action. My core is working so hard because I'm on a ball. And this is, we do need to work our hip flexors, but obviously I tend to focus more on glutes and hammies. So you can, start your runner on the basics, or if you're a runner, get the basics right. And then you get onto some really fun stuff that's functional. And that feels really good when you've got some good music on, not so much when there's none. Looking at maintaining posture, here I'm demonstrating, I call this the 3-way lift on a balance pad. I think that's a video on the left, there we go. Oh, I love a balance pad, guys. It activates all the stabilizers in your ankle joint, through your knee, your core switches on. I've got a resistance band around my knees. I take my knee forward. So it's a hip movement. The knee is not moving. Forward, and I'm trying not to lose my lumbar position. I have a lovely lumbar lordosis. I do struggle. I can't get a lot of extension because I have got tight hip flexors. I blame triathlon. So you've got to make sure when they're doing this that they're not losing the lumbar position. The standing leg is working more than the moving leg, depending on how tight that band is. Beautiful exercise. Another core exercise, people will know this, it's a variation of a plank and into side plank. I get them moving so they can bring in a push-up if they're strong enough, activating their core, then a full front plank into a left side, full front into a right side. If they struggle, start them on their elbows, progress to hands. Lovely, simple core activation, and controlling between the different positions is part of the drill. Go through it slowly, don't fall over. You'll feel the core switch on and you'll see a really good activation through there. And then hip flexors and hammies. I love this hammy drill. I'm actually bringing in some hip flexor work again with the band because my left leg is working isometric hip flexor. I've got glute activation with the hip drive, and I've got a concentric eccentric hamstring. I mean, so even though I'm not standing and it's not my usual standing functional strength work, this is a gem of an exercise in terms of strengthening. And then you can do that with or without a band, with the ball, pikes, hammy curls. I do like, it does give a bit of variety. So much of my strength work is body weight. If I had one message to tell my runners, it's that the majority of them are not strong enough. And running doesn't make you strong for running. It makes you fit for running, and you might improve a bit of your strength, especially if you're doing hills. But often the body just is compensating. And I think that everyone will get more out of their running if they found a way to do 1 to 2 strength sessions a week where they're focusing on some functional stuff for their core and for whatever they need in terms of their run action. Really, it is worth it. Some functional fun stuff. Look where you can go with a bit more dynamic. I mean, the first few reps, I'm all over the place, and then I get it a little bit better. High jump, explosive movement, control the landing. I'm not allowed to let the knee dip in. I'm not allowed to lose the hip position. Eccentrically, slowly lowering off. I tell my runners when they do this as a step up or a jump, land like a ninja. Soft landing, you get the eccentric control. Super fun. And then on the Bosu ball, bringing in a couple of different movements. High knee. Switch the kettlebell, single leg deadlift, core is activating. I'm trying to keep the focus with the single leg deadlift where the weight stays on my heel and I lead with the heel of the swing leg. If the weight is on your toes, first of all, you'll fall off the Bosu. Second of all, you will activate your quads and you just be using quads. Okay. So when they do it statically, no extra weight, keep the weight on the standing leg heel and lead with the swing heel. You will feel a massive eccentric action on your hamstrings, and your hips should glide back and forward. We've got that hip drive action, and you're controlling super functional. Last one on the next video. This is a combination of a lunge, looking for a vertical shin, guys, into a high stand, a little balance drill. I mean, how much fun doing reps of these. It's functional. It's all body weight. You can do this in your living room. And then into an aeroplane arabesque. And then if you can control it without tipping the pelvis, and I had to work hard, you can bring in arm movements, either the diver's arm or a rotation. Just to say that your glute max, the step up elicits the highest activation of glute max if you're looking at the research. So, and hip thrusts outperformed squats, split squats, lunges, and the traditional deadlifts, according to some research in 2020. Hamstrings, the Nordic curl, and challenges the entire hamstring complex. I don't have many runners that are capable of a Nordic curl. I would start them on a single leg deadlift, on hammy curl, Swiss ball hammy curls before progressing onto that. The supine leg curl is good for biceps femoris. Remember, your biceps femoris is your sprinter's muscle. It's your propelling, your semitendinosus, your semis, and membranosus eccentrically, work a bit more eccentrically. And then glute med, your side bridge and your neutral side bridge was probably the highest activation of that. But that said, Single leg squat is excellent. Single leg deadlift is excellent. Rima Nettel showed that, and that side lying hip abduction. Guys, I have runners who can clam and do a Jane Fonda workout till the cows come home, and then I video them, and they've got a huge contralateral pelvic dip. So they can get an isolated glute medius activation in a clam, but they can't run using it. So again, I come back to it, train the movement and the muscle, and educate the runners about what the strength work is trying to do, and then they'll see the changes of the strength work fitting into their running. There you go.
And we done?
Yeah, I know I talked too quickly. Sorry, guys. Hopefully there's some questions there.
Thanks so much, Lauren and Parys. I mean, that was absolutely phenomenal. We had such a good attendance, and I was thinking of questions to ask as you spoke, and you either answered them or other people have asked them. So because we've already had an hour and 15 minutes of superb presentation, we'll keep the questions quite short, and I'll go through some of the main ones that have come through, and hopefully others can go back and review this excellent presentation when it's posted. But I think you've really given us a very in-depth look at what it takes to prevent runners getting injured and to manage injury. And I think some of the practical advice is really something that no matter what our discipline, we can all take back to our practices. So thanks very much for that. Just a couple of questions that have come through. Someone's just asked for you to repeat the name of the app that you use to analyze gait.
So it's now called OnForm, ONFORM, OnForm. It's available on the App Store. I like it. I do pay for a premium version, which just allows me to keep. I have a ton of videos, but you can get. You could get it for free, and it's superb. It's really, really nice in terms of the visual feedback and self-awareness improvement. And of course, my run analysis. It's the mainstay of it.
Perfect. Lauren, your thoughts on toe socks versus traditional socks?
So it depends on the toe sock. The toe sock has to be completely seamless. It is sometimes a personal preference. I'm a massive fan of toe socks. I love them in Gingies, and there's another one in States. The name just escapes me right now. And Gingies are available from Drifters, by the way, or Ultra online. But for somebody who has a pes cavoid foot that has a very wide forefoot, they actually love a toe sock because they can get proper splay and they're not being restricted in any way. Toe socks are also great for patients who have forefoot issues in terms of neuromas, and we don't want any kind of compression on the forefoot. Toe socks help with that splay, and there's no restriction there at all. But it is a personal preference. Try them.
Thanks very much. Your opinion, Lauren, on orthotics and their neurofeedback in altering kinetics and running form. So there was a comment here that despite your orthotic, you still seem to have some mechanical issues. I presume it's, you would never say to anyone that it's a cure-all, but do you believe that those orthotics assist with neurofeedback and probably complement the kinetic work that Parys was talking about? I suppose that was the point of this whole presentation, but some comments on that.
So there is neurofeedback. You can actually enhance the neurofeedback with a different type of, so you're obviously stimulating proprioception, but if you change the cover of the orthotic, I don't have a very neurostimulating cover on my orthotic. If you change to something like Poron, you're increasing the proprioception, which helps retrain neuromuscular junction. But I'm glad that this question was asked because people can see and they're like, oh, but there's still some of the mechanical corrections. The thing here that's important to note, and I'm constantly telling my patients this, we are not trying to make you look perfect from the orthotic. I'm not trying to correct you 110% because there is going to be some kind of compensation from the body and we need to allow for that. I'm trying to correct to the point where the compensation no longer fails and threatens tissue. So yes, I look like I still have those issues. However, with my weakness, I do not have patellofemoral syndrome pain. I have my glute pain or my impingement pain reduces. If I run without orthotics, I cannot get 1 kilometer. Cannot get 1 kilometer without my orthotics and the shoe. So I've resolved the PFS with just the orthotic and none of the strength training. However, there's a whole lot of other things that are coming up as a niggle, but not necessarily as a full-blown injury. The thing to remember here is I'm taking the basics in the sense of the structure, putting it at the structure in the best possible position, so that when you strengthen in that position, you're taking something and you're making it the best that it possibly can be. And that's what's ultimately going to help reduce your injuries.
I want to add something there, John. You know, not every patient will need an orthotic. And I mean, we didn't know, I mean, but Lauren definitely did. And when you study at length, the comparisons barefoot to in trainers, and then the comparison trainer to trainer and trainer with orthotic, trainer without orthotic, there was no question of two things. One, Lauren needs an orthotic, and two, she made a very good one. But yeah, there's a place for it. And I think physios can be hesitant on it. But if you're looking at the running and you're really looking at the barefoot action on the movement test and the barefoot action running, then I know who I'm like, look, you need to go and see a podiatrist, go and see Lauren, get some, it'll make a difference. If I'm not sure, I'll start with some strength work. I'll reassess them. If there's no change, then the orthotic is the answer.
Parys, you're so right, because so often I have a patient who'll come in, and John, some of your patients as well, where I'll say, no, we are starting with the shoe first. Yeah. Go away, go and do some strength training. Let's get you into Parys, let's get some run cues going, let's get strength training going, let's try this shoe, and let's see how far we can get your pain or niggles down. If we get them down completely, perfect. If not, we know that we reach another pain plateau, we need then orthotic to push it down even further, and it's an additional tweak. I do feel that a lot of other colleagues, you know, if you send to podiatrists, they're definitely going to do an orthotic. No, that's not the case.
Okay, I think that's great commentary and a focus on the individual and the individual's needs as a runner. So I think that's excellent. I think just as a last comment from Neil Cable here, he's asked about carbon plated shoes and you know, whether there's a place for them and whether they have a role in improving both form and function. Maybe a last comment from each of you before we wrap that up.
So Sean Pinkers gave an interesting talk last year as a WiSH webinar on carbon plated shoes, if you want to go and have a look at that, because it'll have a lot more detail. Carbon shoes do have a place. There's a hot debate around them. Is it the plate? Is it the foam? There's big evidence pointing towards the foam that is being used in these shoes. And Simon Bartold and Kevin Kirby have a great debate on this. It's all on YouTube. But there's one thing to remember about the carbon plate, and that is mediolateral stability. So the plate is fantastic from a dorsiflexion to plantarflexion forefoot loading, and you're getting that rock in it and you'll feel like you're flying. But if you are not eccentrically strong, you are going to struggle with your mediolateral stability. And it's actually exaggerated in that shoe. It's a hot topic. It's a whole webinar on its own. That's why we did one with Sean last year. So if you want to go and listen to that, I suggest you go and do that. I hope I've
it's on the WiSH website, so go and have a look at it. It's getting to 7:30, so I'm going to wrap up the session. There are some other questions which have come through, but you know, are just too many to answer this evening, having had such a detailed presentation. Really, thank you to both of you for the preparation that you've put in. I think the practical aspects that we can all take home are really phenomenal, and we'll be able to implement those. I think the take-home message is to look at all the intrinsic and extrinsic aspects in the runner and try and address those, and put a very good multidisciplinary team around you if you're going to do what's right for your runner. I think that's very, very critical. So thanks very much for that. Thank you to Asina Lita for sponsoring. Thank you to SASMA for supporting our webinars, and for all of you for attending this evening, to Robin for all the background work. And look out, coming up is some information on our forthcoming talks. We will be joining with Josie and the Center for Sports Medicine and Orthopedics to look at the foot and ankle. And that again will be a multidisciplinary panel. So don't miss that on the 6th of July at 6:30. This one starts. So thank you to all of you. We look forward to hosting you in the coming winter months. It's probably going to be a little better to do than sit in front of your screen with a cup of tea or a glass of wine and watch these webinars. So we look forward to all of you joining us in the coming weeks. Thank you very much and have a good evening.